You are giving this medicines. I said, yes, I do give. He says, do you know what is the risk? I said, I don't know what is the risk. What will happen? He said, look here, there are so many general hospitals in Belgaum. He told me there are so many general hospitals in Belgaum, and all these general hospitals they practice only allopathy. No one dies there. I said yes. A lot of people die there. Then what's wrong if one patient dies of homeopathy? Keep on giving. By mistakes, you will improve. And I did improve. And since then, I've been a strong homeopath. Another instance I would like to give about Drosera, the magic of Drosera, was there was one doctor in his later stage when he was serious in old age or almost after 80 in Kolhapur. He happened to be my patient and he was known as Dr. I won't tell his name. It Dr. S. Is this Dr. S was known as Dr. S, but he had no degree, no formal degree. But he was very fond of reading. Like Dr. Hahnemann was very fond of reading. So this doctor also was very fond of reading, and he read somewhere that one single dose of Drosera can cure whooping cough. In those days, my dear, whooping cough was a full killer disease. The mortality rate was very high. If a child is to get whooping cough, he was sure to die because, as I told you, worse by eating, worse by drinking, worse by talking, worse by crying, worse by sneezing, worse by yawning, worse by lying down, and better by vomiting. So nothing could go inside, and the child used to succumb to death. And those days, because he read it about somewhere, and he became the doctor of whooping cough. Dange Phokla's doctor. He became a Dange Phokla's doctor. He had a clinic of his own, and with only one medicine, there used to be lines every day morning. All the people right from around Kolhapur and the the cities around Kolhapur, the districts around Kolhapur like Sangli, then Satara, Belgaum also, and Ratnagiri and all these places. The people used to come to the children with whooping cough. He used to go give them one dose. He never told anyone what was that medicine was, but he gave them only one dose, and the children used to feel better, and they used to go home. So this was almost randomly he was practicing, and with this practice, he could build a bungalow of his own, and he could marry his four daughters. He had four daughters. This Dr. S. He had four daughters who got married only on Drosera. So one medicine he knew, and with one medicine he became a Dange Phokla's doctor, and he could maintain his lifestyle till he died. Lastly, I had a privilege of treating him. Of course, he died of old age, basically. But why I'm telling you all these things is one medicine had done such a lot of difference because those days there was no cure, or there was no vaccine for pertussis or what we call the whooping cough. So what is whooping cough basically? There's a there's a tickling sensation in your throat, or in the Mater Medica book, it is said that as if there's a feather in the throat, as if a feather in the throat. Imagine a feather in your throat, and there's a constant tickling sensation in the throat, which gives rise to this spasmodic cough, and ultimately, the person can succumb because he cannot eat anything. Nowadays, there is a vaccine, and there are ventilators. You can be put sedated, and then you can be put in a ventilator and all that, whatever it is. But those days, we are talking about the olden days, 100 years back or 150 years back, where most of the people died because of not knowing how to cure this whooping cough. So this was a lifesaver. This remedy was a lifesaver in those days, and still today, whenever I come across a child who says that, the mother says that he ends in vomiting, whenever he coughs, it ends in vomiting. Either I will think of this Kalikarp or Drosera. The difference between Kalikarp and Drosera is Kalikarp is better by lying with the head down. If you bend forward, the Kalikarp is better because Kalikarp is aggravated because of enlarged uvula. This uvula which is there, it keeps on tickling. The moment you bend forward, when you bend forward, the uvula comes in the mouth and nothing tickles. So that's not the case with Drosera, because Drosera has got that feather-like sensation in the throat, and whenever that sensation is there, because of the tickling in the throat, he will keep on coughing, and he, as I told you, he feels better by vomiting. So and it ends in vomiting whenever Drosera, I mean, and then he can go into cyanosis also, because the way he coughs, because till the lung is empty, he can't stop coughing. So it will, again, I'm repeating the cough for you so you can imagine what will happen. So it ends, the spasm ends in a vomit, and that is the most important part of the Drosera cough. And by hearing, without a stethoscope, by hearing how the patient is coughing, I think you should be able to make a prescription only by hearing how the patient is coughing. So that's most important. As far as you have got a sound clinical knowledge, probably you may not need a stethoscope also to diagnose a Drosera case. So, my dear, I'm unmuting you because as far as the important things of Drosera are there, I've already spoken to you, and now you can. I'm unmuting you. Yeah. Wait. Where is that unmute? Mute all. Where is unmute? Hello. Unmute. Whatever. No, not this. Unmute. Whatever. Just, just a moment, please. Unmute. Unmute. नहीं, mute हो गई. Yeah, so good. Can you hear me? All of you all?
Yes, sir, we can hear you.
Okay, fine. Now, you have any questions about Drosera? Yes, Fatima. Can you be please more clear, please? Hello? Hello? Hello, please.
Larynx is affected.
Ajit?
Larynx affected.
That's right. The larynx affected. Yeah, Drosera can also have hoarseness of the throat. Yes, it can have a hoarseness of the throat. But the most important part is the spasmodic cough, which comes in a paroxysms. That's very important here. With of course hoarseness of the voice and all that. Yes, larynx are affected. Yes. Hello. Anyone else? Anyone else? Yes, please.
Sir, how will you differentiate between causticum and spongia?
Causticum and spongia. Causticum again is like what we say. It is a superficial cough, and spongia is like coming out of a barrel. It is hollow cough in spongia, where we see the most important part of spongia is better by eating or drinking. That is the most important. Uh, that's the most important modality in spongia. Better by eating or drinking, because if you eat or drink anything, immediately you feel better. So that's the most important modality in spongia, which it's almost a guiding symptom. तो थोड़ा भी that's why
And cost-
your small children उसको जो guest मत खिलाते हैं मालूम है whenever he has a cough वो guest मत there's one Ayurvedic जड़ी बूटी called guest मत so that guest mud is kept in his mouth and then because the throat remains wet he feels better and causticum of course causticum is there's a lot of parallels of the intercostal muscles there, and that's why the cough is not as powerful as it should be. But spongia, yes, it comes from the depth of the lungs. It is a very strong cough, and it is also can be thought of for whooping cough as far as if the modality is concerned. That is better by eating or drinking. Then we can think of spongia. Thank you. Anything else? Hello.
Yeah. No, sir. Thank you, sir.
Okay. Thank you.